mga ka-webinar. Welcome sa episode 21 ng ating Nutrition and Health Webinar Series. Maraming salamat sa inyong patuloy na pagtatangkilik ng ating weekly webinar. Last week, pinag-usapan natin how to have a balance between inner and outer beauty sa episode. Pero sa episode na to, we are going to talk about understanding men's health. This webinar series is brought to you as a community service by Pharmacia Jimenez with today's sponsors, Cell Life Cellular Nutrition and Cell Life Antioxidants. According to Harvard Medical School, the average man pays less attention to his health than that of an average woman. Compared to women, men are more likely to drink alcohol, smoke, and not see their doctors for regular checkup. But the fact is, men are vulnerable to disease that can affect anyone, like heart disease, stroke, diabetes, cancer, and actually has the unique issues such as benign prostate enlargement and, in worst scenario, prostate cancer. Recognizing and preventing men's health problems are not just a man's issue. Because of its impact on wives, mothers, daughters, and sisters, men's health is truly a family issue. This afternoon, tayo po ay pinagpala to have another doctor of medicine as our subject matter expert who will help us understand men's health and how major risks that men face be avoided and how men can enjoy optimum health and wellness. Our resource person is a family medicine specialist and active medical consultant in Las Bañas Doctors Hospital, Calamba Medical Center, and St. John the Baptist Hospital, also in Calamba, Laguna. Nagtapos po siya ng pre-med at the University of Santo Tomas and had his medical degree at the Manila Central University. He had also his internship at the University of the Philippines General Hospital and his residency in United States Air Force Hospital in Clark. We are so blessed to have him this afternoon. Magandang tanghali po. Let's welcome Dr. Ernesto Pua. Hi, Dr. Pua.
Hi, good afternoon. Nice to be with you again.
Thank you, Doctor. Alam namin busy kayo. Si Doctor just had 2 patients kaya medyo na-late ng konti si Doctor. Tinapos lang po niya yung kanyang pasyente niya. Of course, nag-invite. Thank you, Doctor. Yeah. Of course, aside from our subject matter expert, nag-invite din po tayo ng ating guest para mag-share ng kanilang personal experience about the topic. Our first guest is a BS Math major in Computer Science graduate from the University of Santo Tomas, married with 2 kids, and is currently employed as an AVP of Customer Support of all leading global unified cloud communications provider based in California, USA. A triathlete and soon to be a full Ironman finisher. Welcome, Mr. Joey Lianco. Pleasure to have you here, sir.
Good afternoon, Grace. Good afternoon to all the viewers.
Thank you. Thank you, Sir Joey. And of course, we have another guest. He is a civil engineer by profession turned entrepreneur, a father to 2 wonderful children, and a loving husband, a legit full Ironman finisher. Blessed to have him also this afternoon, Engineer Dennis Cruz. Dahil napapanood tayo via Facebook Live sa ating mga Facebook Live viewers, ini-encourage namin kayo to chat with us, post your comments and questions. Dahil napapanood tayo via Facebook Live sa ating mga Facebook Live viewers, ini-encourage namin mag-post ng inyong questions at ang ating subject expert will try to answer them. You may also suggest a topic na pwede nating i-discuss sa mga susunod na episodes. Should you find this episode relevant to you, kindly forward it or best yet, share it to your friends and family because caring is sharing. Sa mga Facebook Live viewers na mag-actively participate at magtatanong, maaari kayong makatanggap ng special gift pack from Cell Life Cellular Nutrition at Cell Life Antioxidant. So, wag na po nating patagalin ang ating discussion. Let's start. Dr. Ernie, ano po ba talaga ang definition pag pinag-uusapan ng men's health at ano po ba ang napapaloob dito? Tutuloy ko na rin po, ano po ba ang mga dapat gawin para maiwasan ang mga kalalakihan para ma-attain din ang kanilang desired health at well-being? Dr. Ernie?
Sa buhay ng tao, the most valuable is about health, no? Yung ating kalusugan. Importante na we will be living longer without any problem. But men, as you have said, are very notorious for not going to doctor even they have a little problem. That's why we have come up with a program, what we call annual physical examination. It's an irregular program by most of the companies that requires every employee to have a annual physical examination. This is a routine checkup of the physical of the individual, whether they are healthy or not. Especially as you grow old, the most problem things arise. Hindi ka magkakaroon ng mga sakit na malalala kung ikay nag-aalaga no pang medyo bata-bata ka. That's why importante in maintaining and sustaining a life longer without any problem is an annual physical exam. Annual physical examination for a regular company is composed of your chest X-ray, CBC, urinalysis, and stool. I don't know yet if other company has undergone more extensive annual physical if they have program like blood chemistry, ECG, and other specialty tests. I think some company line up pagka more than 40 years old ka, tsaka lang sila nag-undergo ng mga more extensive evaluations of with regard to their health. That's why these are the part of the more important thing. Sa mga present situation kasi, if you try to look at it, the census among male having more problem than female is really high because they are not that so conscious. Ano yan, macho boy daw, pag kumbaga kung tanongin nila sila. That's why critically, very important yung health with regards to men. So we can have our first slide. No? What is men's health in general? Men's health refers to a state of complete physical, mental, social well-being as experienced by men, and not merely the absence of disease infirmity. Schedule yearly check-up with your doctor and keep this appointment. No? Your doctor can help you monitor your weight, blood pressure, and level of your blood chemistry. It doesn't only limit to cholesterol. The most important thing are your blood sugar, your cholesterol, triglycerides, your HDL, LDL, BUN, CREA are also important as a part of the chemistry. But the more important thing is the PSA, which is more detecting with regard to the problem of your prostate. Most men health threats are largely preventable. Naiiwasan lahat sila naman eh. Basta maingat ka at subaybay sa iyong kalusugan, most likely you will not have more problems. Make healthy lifestyle choice such as eating a healthy diet, including physical activity in your daily routine. No? Meaning, this diet is the more important thing. Mukhang buhat nung na-create yung mga fast food at saka naging medyo malalaki ang sweldo ng tao at palabasa nakaupo na lang maghapon sa computer, lumalaki sila ng lumalaki and they forget doing some exercise at all. Men are notorious for avoiding the doctor and ignoring the unusual symptoms. This may help explain why women tend to live longer. Next slide. Why it is important with regards to this health care. The list includes cardiovascular diseases, cancer, diabetes, hypertension are higher in men as compared to women. 80% of all sudden death cases due to unrecognized heart disease occur in men. It's also important to manage risky behavior such as drinking too much and engaging in casual sex. Men are more likely to smoke and drink alcohol and generally less lifestyle change. Next. When to choose your doctor. See a doctor for a regular checkup, even if you feel healthy. This is important because some diseases and health conditions don't have symptoms at first. Plus, seeing a doctor will give you a chance to learn more about your health. They will refer you to a specialist as needed and keep your health record in one place. for future reference. Men and boys should have a physical checkup at least once a year. For men, a primary care doctor may be the first to identify certain conditions, including hernia and herniated disc. These are the more common things that they complain with regards to the backbone pain. Next. Why annual physical examination is necessary? Get preventive care to stay healthy. Screening are medical tests that check the diseases and health conditions before they cause any sign of symptoms. Stay up to date on your shots. Everyone needs shots. These are vaccines, preventable diseases. The most important thing that was developed in our life is vaccine because it is easier to prevent rather than to treat a disease. You know, if we have a COVID vaccine, most likely we will not have this kind of crisis economically and all other problems that we have as of today. Everyone needs shots to stay healthy. Help you track your progress towards your health goal. The role of nutrition is very important also. That's why you need to understand, not because you have sufficient amount of economic, you keep on eating. It is important to eat wide variety of vitamins, mineral-rich foods such as fresh fruit, veggie, and whole grain. Many of those foods are provided health, heart-healthy fibers and natural antioxidant compounds that can help lower your risk of certain diseases. Next, how to stay active. Not only eating and diet is the more important thing in life, you should have a regular exercise. It's one of the best ways to prevent heart disease and keep your ticker strong. It can also help you improve and maintain your overall physical and mental health. Try to get at least 150 minutes of moderate intensity aerobic exercise or a 75 minutes of vigorous anaerobic exercise every week. It should be a regular, hindi yung paminsan-minsan lamang pagka naalala mo at ka mag-exercise. It should be a record talagang dapat mong gawin on a regular basis to sustain your health. No? It is also important to make time for at least 2 sessions of muscle strengthening activities per week. Take a walk instead of smoking. Try to eat green salad instead of rice. Drink water instead of sodas and juices. These are things that are important in life to maintain a healthy well-being. Break the unhealthy habit. What are these unhealthy habits? Most of them, men are known for smoking. Smoking and secondhand smoke exposure can also cause other health conditions such as chronic obstructive pulmonary disease, what we call COPD. This is exemplified by your emphysema, like Zika-like conditions in adults. Heart diseases, they also raise your risk of developing any types of cancer. Other health damaging behavior include excessive alcohol consumption and recreational or habitual drug use. Some men also use anaerobic steroids to increase muscle mass. Possible outcomes include sterility, heart diseases, skin disease, and behavioral problems. If you smoke, drink too much, or use drugs, your doctor can help you develop a plan to quit. They may recommend medication, therapy, or other treatment strategies. Next, protect your skin. Melanoma is one of the skin cancers. These are more common sa mga Australian, sa mga Asian. One of the deadliest cancer. Get your prostate. The prostate is number 1 in men. No? Talagang cancer of men are usually the prostate. If you have trouble urinating, developing pain when you urinate, notice blood in your urine, or it may be sign of prostate problem. That's why going to prostate evaluation by a urologist, they try to fit your prostate size and they can assess you immediately what's the problem. Check your colorectal cancer, especially. It is important to benign screening the colorectal cancer starting around 50 no? Colonoscopy is very important in checking these cancers because in your colon, they will also check whether you have polyps or other non-cancerous growth. Next. Sample. Do you not know that your body are temples of Holy Spirit who is in you, whom you have received from God? You are not your own. You were brought up with Christ. Therefore, honor God with your bodies. Thank you very much. And we hope to have some question and answer for this point. Grace, you are open. You can
Yeah.
open now the discussion, whatever they might be having some problem with regard to their mention.
Yes, Dr. Ernie, salamat po dun sa inyong very comprehensive na diniscuss tungkol sa men's health. Bago po tayo tumuloy sa question and answer natin this afternoon, pakikinggan lang natin po muna yung dalawang guest natin who will share their personal experience and then later on will directly ask you yung kanilang mga katanungan. Unahin muna natin bago si Sir Joey, kasi nawala kanina si Sir Dennis. Are you there, Sir Dennis? Kwentuhan mo muna kami kung paano nangyari. Kasi itong dalawang guest natin this afternoon, Dr. Ernie, if I may just mention, dati silang mga overweight, no? So, tama yung sinabi niyo po, and we agree na most of men now are, kahit yung dati pa po sinasabi niyo, hindi sila masyadong pumupunta sa doktor para magtanong kung ano ba ang nangyayari sa kanilang health, So, yung dalawang guest po natin, si Sir Dennis at saka si Sir Joey, by history, meron silang parang I think problem with obesity na minention din ni Doctor. I think is one of the most common na nangyayari ngayon lalo na sa mga BPOs. Yes, Sir Dennis. Paki-share mo
Yes,
naman yung anong personal experience mo, engineer.
yes. Unang-una po, magandang hapon po, Dr. Pua, kay Dr. Grace, at saka kay Brother Joey. Actually po, Doc, nung medyo bata-bata pa po ako, that was 10 years ago, medyo may kabigatan po ako talaga. So, parehas po kami ng wife ko. Over po ako dun sa weight na dapat na aking talagang tamang bigat. Ngayon, we started po na nag-workout, nagkaroon po kami ng exercise, nag-enroll po kami ng gym before we enter po yung mga events, yung mga races like triathlons, runnings, bikings. So, nag-start po kami ng wife ko. Actually, napag-isipan po namin na magbawas ng pagkain. So, ang unang-una po talaga inalis namin sa aming mga kinakain, yung mga sweets at saka yung mga maaalat po. So, even though na tinanggal na po namin yon, kumakain pa rin po kami ng lahat po ng gusto namin kainin. A little of everything lang po ang aming ginagawa. And then, we have po yung aming regular exercise na hindi naman po sobra-sobra, hindi rin naman po kaunti. At least mga 30 minutes to 1 hour exercise every day. So, ganun po ang nangyari hanggang sa ilang years, naobserbahan po namin na unti-unti po kami lumiit. Then after po namin na lumiit, to maintain po yung ganoong katawan namin o na weight po namin. So, nag-ano po kami, na kumbaga, nag-start po kami ng wife ko na kumain po ng mga foods like yung fruits before po kami kumain ng aming yung main meal, yung pinaka-meal po namin. And then wala naman po kaming hindi kinakain. So we eat pork, beef, meat, kahit po yung mga crispy pata kinakain po namin. We also eat yung cakes. Yun nga lang po, talagang unti-unti lang po yung aming kinakain. And then naging kagawian na rin po namin na kumain ng fruits after po ng workout before po yung aming main meal. Pero pag kumain naman po kami ng main meal, talagang marami. Minsan, nakakadalawang cups ng rice pa nga po kami. So, hanggang sa na-maintain lang po namin siya ng na-maintain. Ngayon, pagka po meron kaming mga races, may mga events po kami na medyo mahirap po yung gawain, that's the time po na kumakain po kami ng marami. So that's the time po yung tinatawag po namin na nagka-carbo load, and dyan din po yung mga may tinitake po kami na supplements para po hindi po bumagsak yung aming immune system. So na-maintain po namin ng ganon hanggang ngayong ganitong edad na po. So mini-maintain lang po namin ng mini-maintain yung katawan namin na hindi po kami umabot doon sa bigat na dati naming bigat noong time po na bata-bata pa kami. Yun po. Yun lang sis, Dr. Grace.
Thank you, Engineer
Sure.
Dennis. I'm sure may tanong ka kay Dr. Ernie. Kasi Dr. Ernie, kung nakita mo si Engineer Dennis dati, talagang medyo malaki siya. Ganon din yung wife niya, si Miss Malen. So, balik tayo sa iyo, Mr. Dennis.
Yes,
Pwede mo
Doktora.
ngayon take advantage because Dr. Ernie is right here in front of us to actually ask your questions. I'm sure meron ka pa rin, kahit you're back now to a healthy and active
Yes.
life, meron ka pa rin katanungan at the back of your mind.
Opo. Doc, doon po sa aming nagiging routine, doon po sa aming ginagawa o kinakain na inaano, meron po ba kayong maire-recommenda na ano po ba yung dapat po na supplement o importanteng inumin po namin, especially po sa amin sa ganito ko pong edad, na safe po siya, na makakatulong po para kami po lumakas o hindi po bumaba ang aming immune system?
Malaking bahagi ng ating pagkain should be based on our blood chemistry and calorie value, no? So if you have done some blood chemistry, you can see already what are the things that should be restricted and limit the diet. And then based on that, kung baga mataas ang iyong cholesterol, I don't think you should start eating pa rin crispy pata, lechon, or anything that are fatty. But you can still have it on a very minimal amount, especially kung hindi naman masyadong mataas. But kung matataas ang number, you might be needing some assistance from the drug itself to lower it down, because sometimes miski anong activity ng iyong ginagawa, hindi pa rin sila bumababa. That's why these are things that are available, not things that you can be helped na mababa yung ating. But in terms of activity, the most important thing is the determination and the will to do it. It is about discipline. It's all about focusing your life that I would like to have a healthy life. Kaya mo magagawa yan. If you don't have that kind of mindset, minsan pagka-diet mo, babalik ka ulit sa dati. Hindi mo masusustain yung activity, hindi mo magagawa yan. But because you value your life, one God-given value to you, talagang dapat mong ingatan yan. Kasi hindi naman atin yan, hiniram lang natin. That's why these are the things that I usually put to the patient. Ikaw ang nag-aalaga sa sarili mo. With the help of God, He will be giving you a proper pathway. Otherwise, talagang patungo ko sa hindi magandang pagkakataon. That's why these are guided. Dapat sana ang ating kinakain, you know to know the value of the calorie. So meron tayong set value, meron tayong requirement, doon ka lang lalagay. But most likely, siyempre yung mga antioxidant, mga medicine, mga antioxidant that will help you to push your immunity is the more important thing, because we are in the field of this kind of worst scenario, this pandemic. Kaya dito, matitira na lang talaga yung matataas ang immunity, yung malalakas na tao. That's why the high-risk individual are the more senior citizens, kasi sila yung nasa madami ng complication, madami ng add-on problem. Diabetic sila, hypertensive sila, ang immunity nila medyo baksak That's why these are things that we should understand. The antioxidant, either in tablet form or whatever it is, will help you. You should be encouraged to take. But siyempre, veggie and fruits are the highest things that will give you a value. No? Hindi sila masyadong matataas ng calorie as long as they are limited in terms of how much do you take. So there's nothing wrong eating anything that you like, but siyempre, a minimal amount. But siyempre, kung talagang mataas, like a blood sugar problem, I don't think you should start taking soft drinks, going to fast food, eating a lot of your sweets. No? So those are the things that are very important. Na talagang this sugar is very bad in our life. No? That's why it's up to you. But siyempre, as long as you have the kind of mindset to really maintain your health, this is the right way. No? That's how it is.
Doc, yung pong supplements na dapat po naming i-take na hindi po namin nakukuha halimbawa doon sa mga pagkain or fruits or doon sa mga healthy food po na tinitake po namin. Ano pong specific na is it a vitamin C, vitamin D or na pwede po naming i-take as supplement
So
po?
there are a lot of available mga nutritional vitamins that you can have. For me, you have to rotate them. Hindi naman po pwedeng for the rest of your program, you just simply limit it to one kind of vitamin. So you have these micronutrients that are inside the vitamin, but most likely you should look for the antioxidant product that will give you. Yeah. Kaya importante that these are the medicines that will boost your immunity. Samtang magpapatibay ng iyong lakas at resistensya. So those are the things that are very basic. But the rest of the micronutrients that is in the vitamins, whether there are multivitamins, whether they are in line with that, depende yan sa iyong needs. No? Kung kasi naman, if you do your CBC, yung hemoglobin, hematocrit, mababa, then you need some iron supplements. So depende yan sa mga activity-related mo sa pangangailangan. But basically, it's the calorie that is more important, that is, will support your health, will support your energy, because what you use are these carbohydrates as your energy source. Okay?
Doc, may isa pa po akong question. Yung pong pag-take po namin ng supplements or vitamins, sa edad po namin na ito, ano po ba ang tamang oras po ng pag-inom nito? Sa umaga po ba or sa gabi po? Kasi sometimes meron po atang nire-recommend na sa gabi po para masarap daw po yung tulog or kailangan po sa umaga para po medyo buhay po ang ating katawan. Ano po ba ang tamang pag-take po ng mga supplements and vitamins po?
So, most likely, yung mga multivitamins, I usually advise sa bedtime because especially kung may pisonti pinyo, nakakaantok sila, yung mga konting pampagana, they make a better sleep. But yung mga vitamin C, calcium, and some other nutritive value, usually you can take it during daytime. Pag mo lamang isasabay yung vitamin C dun sa iron supplement, kasi they will be not absorbable easily. No? So those are the techniques. Basta multivitamins, you take it at night. Yung mga specific single type vitamins, iron and vitamin C or calcium, you can separate them, taking them during daytime.
Ay, thank you po. Thank you po, Doc. Ay, Doc, last question na lang po. Sa
Okay
age
lang.
po namin na ito, Doc, kanina po nabanggit po nyo about yung sa prostate po, yung sa lalaki po. So, kailangan po ba at least every time po na nagkakaroon po kami ng annual check-up, ito po kailangan po bang i-include namin dun sa amin pong check-up? Or ano po ba to? Pwede pong after 2 years or after 3 years? Ganun po.
So basically, yung PSA should be a part of the annual chemistry that to be done. The moment these things go up, you need to see your urologist. But palpating it or measuring with the finger of the urologist should be done also once in a while. So normally, it is the neurologist that will tell you when to come back, especially if they feel something wrong when they palpate. You know, that 30 finger is the best instrument in telling what's going on in your prostate. That's why the urologists are very skilled telling your prostate what is wrong. That's why once in a while, after you have done your annual physical, you can visit some of these specialists, no? Yung mga not a part of the aming ginagawa, but the specialists do it for you na mapalpate nila yung prostate nila. Kasi sometimes, even things happen na madali nilang madetect with their fingers. Hindi kailangan yung ultrasound. The urologist will tell me always, Doc, yung finger ko lang dyan alam ko na anong may problema. No? These are things that very critical for them. No? That's how you need to do it. Kaya lang natin chinecheck siyempre because cancer of the prostate is very common on men. Tayo lang ang merong prostate kaya talagang number one cancer prone natin yan. No? Ang susunod na siyempre yung mga pulmonary and some other parts ng ating body. Prostate is very critical. Ayaw mo namang umidad na may solda sa iyong ating kasi pagka lumaki yun at nagkaroon ka na ng problem sa pag-urinate, ang solusyon lang dyan, catheter. Ayaw mo namang mabuhay na may catheter for the rest of your age. Kaya usually, you really evaluate them. Okay? Thank you.
Opo. Thank you very much po, Doc.
Thank you, Dan.
Thank you, Engineer Denny. So I'm sure si Miss Malen, sabi nga natin, ang men's health is not just an issue of men, but it's an issue of the whole family, di ba, Dr. Ernie? So for the ones who are watching, makinig po kayong mabuti kasi maraming mga asawa ang hindi nagsasabi sa kanilang mga asawang babae ang mga nararamdaman nila kung kaya't minsan late na rin nalalaman na may problema pala si Mister. So, anyway, Dr. Ernie, salamat po. At Engineer Dennis, we'll go back to you in a while.
Yes,
Nabanggit
salamat.
sa akin, thank you. Nabanggit mo, Dr. Ernie, sa akin one time when I visited you few weeks ago, no, na most of your patients that you see are mga BPO employees. Kasi alam nga natin, the BPO industry is considered the Philippine economy's true primary legs. Of course, kasama dito yung mga OFWs. Pero sabi ni Dr. Ernie, recently maraming mga BPO employees ang mga tinitignan niya sa clinic, yung mga lalaki, na maraming problema silang kinakaharap ngayon. So, that's why we actually invited si Sir Joey para mag-share sa atin ano ba yung mga common struggles nila and common challenges nila as a BPO employee. Sir Joey.
Yun. So, good afternoon po ulit sa lahat. So, yan, ako naman po, I've been in the BPO industry for close to 20 years na, no? So, right from college, sa BPO na po ako napunta, year 2002, nag-start po ako ng career ko. So, around age 21, 22. So, during that time, so batang-bata pa, so, yun, yung mga social gatherings, especially kapag may mga sarili ka nang hinahawakan, mga team members mo, you need to build team building. And usually po, pagka nagkakaroon ng team building, of course, may team building exercise, but on the side, meron ding mga social drinking. Yun, I mean, nung kabataan ko po siguro, kahit po galing sa trabaho, especially pagka gabi po kami nagtatrabaho, ang inuman po namin sa umaga. So, may mga pagkakataon pa nga na pagkatapos ng inom, mga bandang 4:00 na ng hapon, tapos merong pasok ng 1:00 ng madaling araw. So, well, nung kabataan ka po yun, I mean, siguro po nung habang tumatagal, medyo nagiging conscious na rin po ako sa health ko hanggang sa nagpakasal po ako at age 28. Ang challenge ko naman is hindi na more on dun sa bisyo, more on to really how to maintain yung diet, especially kapag stress. Yun po, sa long hours ng trabaho po minsan, hindi ka nakakakain ng tama sa oras. Tapos pagkakakain ka na, gusto mong kainin lahat kasi yung parang yung feel mo na gutom ka na. Tapos pagkatapos po ng kain, dahil sa haba na rin ng oras ng trabaho, wala ka na rin pong exercise, tutulog ka na lang kasi may pasok ko pa sa kinagabihan. So, yung situation ko naman po, at least medyo naging health conscious po ako, siguro mga late 20s, age 39 po ako ngayon, late 20s and early 30s. And the reason being po is because of my wife naman. A year after po namin magpakasal, nagkaroon po kami ng baby after 3 months. Nagka-stroke po siya, a stroke in the young kung tawagin. So doon, kung kumbaga, na-realize ko na, kumbaga yung buhay natin, bigay lang ng Lord yan. And hindi natin alam kung kailan kukunin. 'Di ba? So yung event na yun na nangyari sa buhay namin ng family. So talagang naisip ko po na it's time for me to be healthy. So pero hindi po ganoon kadali. I mean again po, challenge ko talaga is yung how to eat well, eat healthy. And even po sa mga recent years, siguro po until last year no nung nag-join na po ako sa triathlon, prior po noon, umabot po yung weight ko ng around 216 pounds. Ayun po yung biggest weight ko. Ang ideal weight ko po sa height ko is mga 175 lang po ata. So, umabot po ako dun sa point na nararamdaman ko po na kahit konting lakad lang mula sa parking ng opisina, papasok sa opisina, hinihingal na po ako. Ganun, konting lakad lang. So sabi ko parang I need to take care of myself kasi nga po, ayun, I mean, I need to make sure na I can provide for my family. And then isa pa po, no, share ko din. I mean, good thing, hindi po ako na sa smoking. Ang dad ko naman po kasi, yun, yung lahat po nung binanggit nyo, emphysema, COPD, simula childhood po kasi ng dad ko, smoker. And yun din po yung kinamatay niya due to cancer of the lung. So, ang dami ko po na-experience, not necessarily myself. So, yun naman po. I mean, I'm trying to be healthy. But wala pa po ako dun sa peak ng healthy living kasi may mga ons and off pa rin po na yun, pagka na-stress sa trabaho, kakain. Tapos yung exercise, pagka sobrang puyat ka na din, hindi ka na rin po makapag-exercise. So yun po, Sis Grace and Doc.
Oo. I think si Sir Joey also has some photos to show. Nandyan ba, Sir Joey, yung photos mo nung overweight ka pa?
Yes, isa-share ko lang. Wait ha.
Oo. Kasi
Sana wag niyo akong tawanan, ano?
we're waiting, Doc Ernie, no? Yung dalawang guest natin yan. Parehong, yan. Okay. Go ahead.
Pero may katabaan siya no, na 200 pounder kasi.
Opo, ayan. So, feeling ko, yan po yung pinakamabigat kong weight nung panahon na yon. Yan. So, yan po yung before and after. So, ngayon po, medyo nag-gain po ako ng weight ng konti because po, yun, dahil po sa lockdown natin, pero nandun pa rin po yung conscious effort na, oops, hindi pwede to. Kailangan ko maging fit.
Mm-hmm. Do you only have one photo, Sir Joey? Diba? I think you have two to show.
Yan lang yung makita ko eh. Pero yung iba, mas malaki pa dyan.
Mas malaki pa dyan. So, Sir Joey, thank you for sharing that photo and thank you for sharing that experience. I'm sure meron ka rin katanungan kay Dr. Ernie. Kasi nga, aside from being the AVP of your company, of the company that you're working for, may mga katanungan ka para sa mga iyong kasamahan sa trabaho na pwedeng masagot ni Dr. Ernie ngayon.
Yep, yung unang-una ko pong tanong, Doc, since yung trabaho po namin talaga is panggabi, yung tulog po ba sa umaga and versus yung tulog sa gabi, may difference po ba siya? I mean, kasi po wala po talaga kaming chance matulog sa gabi, sa weekend lang po and then during weekdays, sa umaga po talaga. I mean, may kaibahan po ba yung tulog sa umaga versus dun sa tulog sa gabi?
Talagang may kaibahan ng tulog sa gabi at tulog sa araw. It's about hormonal, no? It's your stimulation of your growth hormones is usually happen at night. No, that's why it is very important. Yeah, madaming bahagi ng mga pasyente ko, especially in call centers, no? Ang problem, headache and dizziness, because they could hardly get a good daytime sleep, even they have time, especially among family mothers. So, asikasuhin nila yung baby nila, pagkain ng papasok na anak nila, and a lot of things, they could hardly get a good sleep. That they end up having a lot of absenteeism sa kanilang work because of this kind of headache and dizziness. That's why, mapapansin mo, that's why I was commenting na lahat ng call center, ang ibaba kainan. Because most of the time, ito yung problema ng mga basta wala kang ginagawa, gusto mong kumain ng kumain. That's why I was telling the rest of my patients that it's about this in itself. ikaw yung may disiplina, ikaw yung nagmamaneho ng buhay mo. You know what direction you like to go. No, that's why it is very critical, ano bang focus mo sa iyong buhay. Is it you want na maging healthy? Then definitely you need to do a lot of things. Because when you focus yourself on single focus mo, and your direction is toward there, most likely you can do it everything easy. But pagka ikinaligaw, desire na hindi ka diretso, paliko-liko ang daan, you will never reach the right and right path. That's why the more important thing is educate the patient. Ako, ini-educate ko yung pasyente ko, what's the value of diet and exercise in regard to their health. Especially pagka mga pasyente ay ganun ng mga night worker, especially sana kako, you could have a good sleep sana din sa daytime. Pakiusapan mo yung mga kasama mo sa bahay na bigyan ka naman ng panahon makapagpahinga para naman meron kang konting energy sa pagpasok sa iyong trabaho. But iba talaga ang tulog sa gabi at saka tulog sa araw. It is about the hormone that they supply at night better than daytime sleep. No? I hope you will be able to do that better in doing your job sa araw rather than night time. Mga pasyente nga na nakikita ko miyat-miya na lang pumupunta sa akin because of headache, dizziness, miyat-miya na lang umaabsent. Sabi ko, I don't think this is the right kind of job that you are engaged to. Even if it's a high-paying job, pero if you are sacrificing your health, may maghanap ka naman ng bagong hanap buhay na pwede namang magiging maunlatan yung kalusugan.
Thanks po, Doc. And follow up ko po, Doc, yun nga po, no? I mean, dun sa tulog sa umaga, meron po bang mga pagkain or mga vitamins na makakatulong po para makatulog ka? Kasi yung iba po talagang hirap na hirap. May oras naman po matulog, kaso hindi po talaga makatulog.
Malaking problema talaga yan. Baka anything that will induce sleep is what you call tranquilizer. And when you start on that level, hindi maganda yan. That's why I was telling people, there are other alternatives that I give. And most of the second drug that I use are your antihistamine, which is non-addicting, but sometimes ang side effect ng mga antihistamine, nakakantok para makatulog ka. But definitely, depende yan sa iyong kasama sa bahay. That's why, ang una kong sinasabi, pakiusapan mo yung mga kasama mo sa bahay, nabigyan ka naman ng panahon matulog. Kasi kung talagang madami kang ginagawa, madami kang alagain, talagang hindi ka makakakuha ng magandang pahinga. Especially during this weather na kung hindi naman affordable ka sa iyo, napakainit ang panahon, hard to get to sleep, talagang mahihirapan ka talaga makakuha ng magandang pahinga. But I think it is all about mental exercise. That if you focus yourself, I need to sleep, then you focus on that, then most likely you can get a better sleep.
And sinabi niyo po yung mental health, no? I mean, how to tell yourself na kailangan mo talagang matulog. And ang isa ko pong tanong siguro is yung sa naman po, stress eating. Paano po ba malalabanan yung stress eating? Kasi para may mga pagkakataon po talaga na gusto mong kumain, na nagka-crave ka sa bad food, pero hindi mo maiwasan, kumakain ka pa din.
Yeah. As long as that are a minimum amount. That's why what I teach my patient, know the calorie of everything that you eat. Because if you know the calorie, you will be restricted to get so many. If you know the total calorie per day that you need just to eat, I don't think you can go beyond that. Because as you value yourself and focus yourself on the restriction, you will be kontento ka na yan. Hindi naman masamang kumain, but you know when to stop. Yun ang mahirap sa tao eh. Yung nawawala yung disiplina nila pagka nasa harap ng masasarap na pagkain, especially in parties. Minsan lang naman, Dok eh. May bali na ito. Yeah, that's why when I tell my diabetic patient, sabi ko, how strong is your discipline? Sabi ko nga, pagka nag-Christmas party sila, I offer them the ice cream. Most of the diabetic dadampot ng ice cream. So that's why sabi ko, that's how the discipline is all about. I just trying to challenge you and teach to it who will among you will dadampot ng ice cream? Because these are the things you think about discipline in yourself. Mahirap talaga yung disiplina talaga yung discipline of how you execute things, no? Because you have a definite goal, talagang mahirap. Miski nga ako, minsan, pagka ako yung napapagod na, but kailangan kong gawin, ginagawa ko pa rin. But those are the things na inaano ko na lamang na I just need to do my exercise regular. That's why, sa akin kasi, ang pinaka-importante ay yung disiplina ng sarili. You should know your life, the value of given to you by God. Okay?
Yan, thank you po. Mabuti na lang, hindi po tayo nag-meet at hindi niyo ako inofera ng ice cream kasi hindi ko pa po alam kung aabutin ko. Pero siguro pa follow up question ko naman po in relation to my yon triathlon, no? Kasi simula ko lang po last year and ma-share ko lang din po at one time kasi habang nasa gym po ako parang na-experience po ako ng pagkahilo. Siguro dahil din po sa puyat tapos ang nagpa-check po ako ng dugo, sabi yung red blood cells medyo mababa. Unang tanong ko po is nakaka-epekto po ba yung kulang sa tulog dun sa pagbaba ng red blood cells?
Yeah, it can also contribute to the cell growth, kasi it depends on your hormones ng iyong growth hormones sa iyong bone marrow na siya nag-generate kasi nagpo-produce ng red blood cells. But malaking bahagi ng mga athletic, ang main problem are electrolytes. Your electrolytes that affect you so much. No? That's why these things, yung salt and potassium are the depletions of most of the athletics na nakakapagbigay ng malaking problema. That's why as long as you learn what's being needed and adjust yourself with those kinds of activity and medicine o kaya inumin makakapagbigay ng supplement, you should learn. Kasi educating you yourself, the needs, what you need is the one that you need to take. That's why it is critical. Alin ba yung mga bagay na kailangan mo na dapat mong gawin? Otherwise, may hirapan ka talaga pagka may symptoms na saka ka lang magko-complain. So know the things that you need and do it with them. Okay?
Okay po. Last na lang po question ko. Meron po bang minimum number of hours na tulog para po makapag-workout ka? I mean, ideally po, di ba, 8 to 9 hours of sleep. Pero sa katulad po namin na minsan hirap matulog, meron po bang minimum dapat nakatulog ka ng ganitong kahabang oras para makapag-workout ka? Pagka hindi ka nakatulog ng ganyang kahabang oras, wag ka na lang mag-workout. Meron po bang ganun? Minimum number of hours of sleep?
The minimum hours is 6 hours. Minimum yan. No, you have to have a good sleep. But there are different kinds of sleep. The best kind of sleep is when you have dreams. And the dream should be a good one. Gaano kalimit ka matutulog na nakakakuha ka ng magandang pangarap? It's very rare. No? Kaya minsan, miski nakakuha ka na ng 8 hours, para bagang hinang-hina ka pa rin at kalos na kalos ka. But yung mga tulog, yung nap sa tanghali, yung 10 minutes nap na tulog sa tanghali, it's very nice. Talagang kalmante at you regain your energy just for a 10-minute nap. But if you talk to psychiatrists and everything, sabi nila, the best kind of sleep is when you have a dream. So, pag ako na natutulog, napakabitalan kung makapangarap no? Most often time, naagat ka, nahulog ka, nagigising ka bigla. Those are the things nangyayari. But how to get a good dream is I keep on asking the psychiatrist, paano ako kukuha ng magandang pangarap? They themselves cannot answer that. But that is how. A 6-hour sleep, night, and a good dream. And the best thing of them. Kasi pagka magaganda daw ang dreams mo, your growth hormones are stimulated. Okay?
Okay. Thank you po, Doc. Okay na po, Sis Grace. Thank you.
Thank you, Sir Joey. Thank you for sharing that. Kahit na alam kong busy rin si Sir Joey. Mamaya babalikan namin kayo ni Engineer Dennis. Dr. Ernie, nabanggit mo rin during the time na nag-usap tayo na aside from the BPO employees, ang common cases that you get to see lately yung overweight, obesity, and I think yung leading to diabetes. So very timely yung question natin from our live viewers. Dr. Ernie, does long-term use of insulin does long-term use of insulin bad, most especially to a patient diagnosed with cancer? Is long-term use of insulin bad, most especially to a patient diagnosed with cancer?
Once you are a diabetic, the problem is the supply of insulin by your pancreas. The pancreas supply the insulin, no? Na nagpapababa ng blood sugar mo. So insulin is not bad in any kind of situation because it is a natural hormone that is needed to bring down your blood sugar. So kaya nga sinasabi ko sa pasyente, yung mga ininom yung tabletang pampababa ng sugar, nothing. Even the insulin plant na mina-advertise is not insulin itself. Insulin is protein kasi, protein na siya. Pagka nilunok mo yan, digestion yan, it will not be an effective one. That's why walang insulin available currently na tableta. Lahat sila tinuturo sa immune system. So sabi ko nga, pagka isang pasyente na diabetic who has been taking 4 kinds of drugs na hindi pa rin niya kayang ibaba ang blood sugar niya, sabi ko, tigilan mo nang uminom, magturo ka na. Walang masama sa insulin. Insulin, hindi mo dapat katakutan. It is the natural hormone needed by your body to bring down your sugar. So there is nothing wrong with any situation, whether you have cancer, whether what kind of illness that you have, you need to control your blood sugar. Sugar is the one that you need to focus yourself na kailangan mong bumaba siya doon sa normal. No matter what programs that you are taking, kung hindi mo naman nakikita successful ka bringing it down, your last option is only insulin. Natural hormones by the body. Currently ngayon, madami ng uring insulin. No? Ngayon tayo, noong una nga, mga galing pa sa pork, sa mga animal ang ating insulin. Ngayon, kasi human na So wala na masyadong side effects and they are getting better. The needle are very fine that you can inject it without pain. So I don't see why insulin will be the reason why na kaya mo ayaw gamitin it because it will do you harm. It is not. No? Kung sabi ko sa mga pasyente, kung talagang nahihirapan ka ng bilhin ang maintenance drug mo at napakamahal ng mga gamot orally, you can switch insulin kasi mura lang ang insulin.
Mm-hmm. Having said that, Dr. Ernie, nag-follow up question din po. Actually, si Miss Beck Jimenez Cruz yung nagtatanong, follow-up question, Dr. Ernie, does insulin damage the liver?
What? Kindly repeat, medyo nag-stammer yung internet.
Does insulin damage the liver?
The liver? I don't think so. It's a natural kasi, no? So, sa annual physical examination, meron tinatawag na liver enzyme na ginagawa din kami. So, for patients who are saying, ito bang gamot ko, doktor? Masisira yung atay ko o kaya madadamage yung aking bato. Well, it is guided. You have some laboratory test that will give you proof that it is not a damaging one to yourself. So, insulin is a natural hormone. No? Hormone siya ng pancreas. Hindi yan masama kahit anong sitwasyon at walang idudulot na ikasasama sa lahat ng parte ng katawan mo as long as you give it appropriately and based on the number of your blood sugar.
Okay. So, I think that's very clear, Dr. Ernie. Hindi insulin ang dahilan dun sa mga pag may diabetes tapos nagkakaroon ng mga, what's this one? iba pang diseases aside from diabetes. So, thank you for that, Dr. Ernie. Sagutin pa natin yung ibang questions from our live viewers bago tayo ulit bumalik doon sa ating guest. From Chris Chualao. Good afternoon po, Dr. Ernie. Just want to ask, as a young man and still feeling healthy, what can we do at an early age to avoid the common sickness of men when we grow older aside from exercising? Thank you po, Doc.
The first thing that you need to do is your annual physical examination. Know if you have problems at that early age that you can control immediately. So you don't need to have them during your adult age. So actually, most of the diseases are preventable when you do it early. Bakit mo iintay pang matanda ka saka ka magagawa ng mga ganitong evaluation? That's why it is critical for you to do the earlier evaluation. So wala namang masamang pumunta sa doktor eh. Hindi ka naman dapat matakot sa doktor. They are there to help you and give you a good analysis of what you can do for your life to make longer and healthier.
Okay. Thank you, Attorney Chris Chuala, for that question. So, narinig mo yung sagot ni Dr. Ernie. Sa susunod na tanong po natin, Doc, another question po, yung vasectomy po from Christopher C. What is the side effect of vasectomy?
Well, there's nothing na side effect naman kasi you still excrete a level of desired excretion when you have the actual sex, no? So vasectomy cut only the one that produces the sperm that makes this problem of pregnancy. But the hormones that come from the prostate and the seminal fluid that comes with it is the one that is still ejected. So there is still satisfaction. But for mindset, so siyempre minsan, nag-iisip agad ka ng hindi ka magiging happy when you have that kind of vasectomy. That is the wrong options among male eh. No? Yung mga lalaki, may macho image yung mga yan eh. Kaya rather than they will do the vasectomy, pipilitin yung asawa ang magpalaygate. Ikaw na lang ang magpalaygate kaysa sa ako magpapavasectomy. So there's nothing naman kasi as long as you really know why are you doing it. No, wala namang magiging magandang reasons why you will avoid it.
Okay. So, I guess, Doctor, maliwanag yung sagot nyo dun sa tanong ni Mr. Chrissy, no? Walang side effect yung vasectomy. So, pwede siyang gawin as a way to control or parang family planning, Doc. Tapos, Doc, bago tayo kumuha ng last question, banggitin ko lang, Doctor, you were saying earlier, kasi I think ang concern ng dalawang guest reactor natin, na parehong may history ng tama po ba ang overweight and obesity, isa rin po ba yon? So dati silang merong ganong concern, kaya sila nag-start mag-engage sa multi-sports. Binanggit po nila kanina kung ano yung mga supplementation na importante for men. Doc, banggitin ko lang po, tama po ba yung pinag-aralan natin dati nung we were discussing na ang sinasabi, it's not enough that we just feed the cell with the macronutrients and the micronutrients. It's also important na sinabi nyo kanina, it was very clear na meron dapat antioxidants. Tama po ba yun, Doctor? You mentioned about it.
Yeah, that's important. There are mga gamot that is very high in antioxidants. That is important in your immunity to protect you from all inherent na mga pagkakasakit natin. That's why these are best. So, malaking bahagi, dapat mong titingnan kung ano yung iniinom mo, magbibigay ng konting lakas at resistensya sa iyong kalusugan. So those are valuable substance. It will give a better immunity.
For better immunity. Buti na lang, Doctor, yung ating sponsor this afternoon, ang Cell Life natin is a densely packed nutrients, merong macro and micronutrients, tapos partnered pa siya ng ating antioxidant na sinasabi niyo, yung ating Cell Life AO. So, meron tayong perfect partner para sa ating men's health. So, um, hindi po nagpa awat ang ating nagtatanong si Ma'am Beck. Sabi niya, can fatty liver? Sorry, nawala. I'm sorry, Doc.
Well, a part of the fatty liver is the common.
Can fatty liver be cured po pala? Sorry.
Fatty liver common time, are related with your cholesterol, triglycerides, and your LDL, HDL. So if you have that kind of conditions, when they do the ultrasound and they say you got fatty liver, then you need to do the evaluations of your lipid profile. Alamin mo kung gaano kataas sila. Because when you bring it down there, most likely your liver fatty will also decrease in size. The problem in fatty liver, they are also correlated with gallstone problem. Because once the liver excrete a fatty substance, sometimes this fatty substance nagbububo sa gallbladder. Kaya tuloy nagkakaroon ng bladder stone. That's why it depends on your cholesterol, triglyceride level in your blood chemistry. So when you have that, evaluate your chemistry and bring it down as much as possible to lower than the fatty liver. Also, you can do your SGOT, SGPT to tell whether it is affecting already the functions of your liver.
The functions of your liver. Okay. Thank you, Dr. Ernie. If there's anything na nag-register sa akin, and I think for the rest of the viewers, yung importante, yung sinasabi nyo that we have to know the numbers. Tama po ba yung sinabi nyo kanina na even the caloric intake na dapat alam natin, yung gaano kadaming calories yung tinitake natin. And aside from that, I think it's important pag pumunta tayo for a check-up nung magkaroon tayo ng mga laboratory exams para din malaman natin yung mag-gauge nung ating doctor, family doctor, yung mga numbers na dapat nating binabantayan. Di ba po, Dr. Ernie? So yung annual physical exam is very important.
Yeah, in the treatment currently that I'm doing, I would like the patient participate on how they will manage themselves. They have to be educated of the value of the number. Sabi ko nga sa kanila, I'm not concerned more of the number than what you are complaining. Kasi importante na yung number mo nasa normal. No? Wala ka ng complaint, maganda pa yung number. Most likely you're on the healthy side. But when you have the number abnormal and yet you don't have symptoms, sasabihin, Tutor, wala naman akong symptoms eh. Baka naman talaga yan ang normal para sa akin. There is no such thing like that. No? Normal value are being already studied and analyzed. Ito yung dapat na number mo na dapat mong maintain nasa tama para wag kang magkaroon ng complication in later life. Kasi pagka na-develop na, like cholesterol, mataas, nagkaroon ka na ng deposit sa iyong blood vessel, naging arteriosclerotic, na hindi naman maalis yan maski bumaba yung cholesterol na eh. So those things that was attacked already in your system, hindi na babago eh. That's why whatever happened, talagang you need to understand that the management of health should start at the very early. Kasi pagka na-develop na yung sakit, hindi na mabago eh. Yun ang nakikita ko.
Thank you, Dr. Ernie. That was very clear. So sa lahat ng mga nakikinig sa ating mga kalalakihan, katulad na din ng sinasabi namin sa sport, know your numbers and understand them well. So, ayan po mga ka-webinar, lagpas na naman po tayo sa ating 1 oras na kwentuhan, discussion. So, bago po tayo mag-close, balikan ko lang po yung ating guest reactor, si Engineer Dennis, before we close. Yes, Engineer Dennis, ano po ba pwede mong ipaalala at gustong i-message sa ating mga live viewers bago tayo mag-close?
Siguro katulad nung naging nakagawian namin na ginagawa simula nung bumaba ang timbang namin, siguro a little of everything lang siguro yung sa pagkain. And syempre wag kakalimutan yung supplements, sabi nga ni Doc, kung merong kailangan yung antioxidant. So kailangan magte-take din tayo para lumakas yung immune system natin. So, as much as possible, kailangan, kumbaga, meron tayong bala every day So siguro malaking tulong yung mga antioxidants sa dapat natin i-take. So dapat siguro pipili tayo ng magandang antioxidants na magbibigay sa atin ng lakas na gagamitin natin sa pang-araw-araw. Yun lang, and maraming salamat po Dr. Ernie Pua sa mga information po na naibigay niyo po sa amin. So malaking bagay po 'yun at magagamit po namin sa pang-araw-araw. Kay Dr. Grace din, maraming salamat sa pag-invite niyo po sa akin. At nag-guest po ako dito sa inyo. Kay Brother Joey, thank you very much din Kita tayo uli. Hi nga pala dun sa wife ko po, kay Malen.
Very loving husband. Thank you, Engineer Denny, sa uulitin. At of course, sa ating Sir Joey, ano ang iyong last message sa mga kasamahan mo sa BPO para maging healthy at maging katulad mo na multi-sports athlete na rin?
Ayun, so sa mga kasamahan ko sa BPO industry, I think ang message ko lang is there are things that we cannot control. Like yung oras ng trabaho natin. Pero there are so much things that we can control. And yun nga, yung proper diet, yung less bisyo, of course, kung hindi matatanggal kagad, unti-unting alisin. And then siguro yung sinabi ni Doc, yung numbers, importante. I think wala namang bawal, pero in moderation. Tapos huwag tayong matakot talagang magpakonsulta sa doktor. Sabi nga ni Doktor is habang bata pa, magandang magpa-check up na tayo. Huwag na nating intayin sumakit pa bago pa tayo magpa-treatment. So prevention is always better than cure, sabi nga, diba? So maraming salamat Dr. And Sister Grace for inviting us. Marami ako natutunan talaga na gagamitin ko in my journey to become more fit. So thank you for inviting me. Maraming salamat.
Thank you. Thank you for your time. Matutulog ka na kasi may pasok ka ulit, Sir Joey. Salamat po. May pasok siya ulit. Salamat. At balik tayo kay Dr. Ernie. Dr. Ernie, maraming salamat po. May isa lang po akong request bago po kayo magsabi ng iyong last message sa mga nakikinig. Binabati po namin ang aming mahal na ang mother-in-law, si Mama Baby Lucina Jimenez. She's watching pero nasa hospital po siya ngayon, nagpapagaling. Dr. Ernie, nakikinig po siya sa mga sinabi niyo, especially she is diabetic also. So, thank you so much for your time, Dr. Ernie. We appreciate you. It has always been a pleasure hearing from you, lahat ng mga sa dami ng natututunan namin every time we listen to you, every time we see you in your clinic. I know Saturday is a very busy day for you, pero pinaunlakan niyo po kami. Maraming salamat po, Dr. Ernie. Your last message po.
Well, thank you, Grace, for inviting me. It's a nice opportunity to share some of the things that I have been known to the rest of the listeners. So maganda talaga mapag-usapan kasi health is more about educating everyone what is needed to maintain their life and to sustain a healthy one. So those are the things that is very important. Kasi kung hindi mo naman alam, wala ka talagang gagawin tamang pathway. That's why these things are educating the patient, educating everybody, know them early so that you can prevent things from happening bad of every life. Okay? Thank you very much, Grace. Magandang araw po sa lahat. Sana po kayo keep on healthy, iwasan, mag-ingat, at tayo po ay mag-ingat sa ating buhay. Thank you very much for having me.
Thank you po, Dr. Ernie. Blessings po sa inyo po ni Dr. po and the whole family. Sa susunod na episode, we will discuss naman ang orthodontic treatment and its related diseases. Kasama na din po ang periodontal disease at paano po ito maiiwasan ng bawat miyembro ng sa ating mga tahanan. We will invite a doctor of dentistry to share with us all about this topic. It is going to be another timely and interesting topic for everyone. Just visit and like our Facebook pages, Cell Life and Oranim, Settle and Settle Active, IC and No Rush, Neem Clean, Alcohol and Hand Sanitizer at PJC Organic Soaps. Sa mga interesado sa aming mga produkto, you can visit our website at www.farmaciajimenez.com. You can buy also our products sa mga leading drugstores like Southstar Drug, Generica Drugstore, Mercury Drug, the Generics Pharmacy, at sa mga authorized provincial distributors nationwide. We will see you again, God willing, next Saturday via FB Live for another episode at Nutrition and Health webinar series. From my home to yours, blessed weekend po. Thank you.